Hello, you are most welcome, ladies and gentlemen, to today's tutorial. Today we want to continue our journey looking at muscles of the thigh region. We've already seen muscles that form the anterior compartment of the thigh. Today we want to look at that of the medial and posterior compartment of the thigh. Now remember that generally muscles that will form the medial compartment of the thigh will be supplied by what we call the obturator nerve. So the obturator nerve will be the main nerve which will supply muscles of the medial compartment of the thigh. And generally these medial compartment of the thigh muscles will be referred to as adductors, so that they can help bring the entire lower limb closer to each other, closer to the midline of the body. Well, one other thing too that we have to know is that they are going to be supplied by what we call the obturator vessels as well. So without much ado, let's begin our journey looking at muscles that form the medial compartment of the thigh, and then later we look at that which form the posterior compartment of the thigh. So looking at this is one of the muscles of the medial compartment of the thigh. This muscle, okay, that you find over here, all right, this muscle, the superficial muscle, is known as Adductor Longus Muscle. So this Adductor Longus Muscle, it's actually, you can see it's more or less triangular shaped or fan shaped, muscle, which, it's superficial. There are actually three muscles of this one. You have Adductor Longus, Adductor Brevis, and Adductor, Magnus, okay, from superficial to deep. Now, if you remember, when you looked at the femoral triangle, the femoral triangle, you saw that there was the medial boundary was actually coming from this adductor longus muscle. So this muscle will actually originates from this area. This is the body of the pubis, okay, body of the pubis, all the way to insert on actually the medial lip of what we call the mid shaft, okay, of the femur, actually of the linea aspera, medial lip of the linea aspera. Okay, so actually you can say the medial 1/3 of actually the shaft of the femur, okay, but actually inserting on the medial lip of the linea aspera. So this muscle is very important when it comes to adduction, because I already told you that this muscle is actually going to help in adduction of the muscle. So I'll actually show you what this adduction is, as well as also helping in flexion of the thigh. So I'll actually explain, look at that one. But I told you that these muscles are going to be supplied by what we call the medial compartment of the thigh, will be supplied by what we call obturator nerve. This is actually going to be supplied by the anterior division of the obturator nerve, because what happens is that deep to this muscle, immediately deep to this obturator, adductor longus muscle, we have what we call adductor brevis, and in between, somewhere between the adductor longus muscle and the adductor brevis muscle will be a nerve, okay, a branch of this obturator nerve known as the anterior division of the obturator nerve. So actually this is what I want to show you. Now if you remember this, you saw this femoral artery, femoral vein, we saw this that kind of saphenous nerve, okay, and then we also saw nerve to vastus medialis, okay, we saw that one there. Of course, vastus medialis, the nerve will be lateral, and then of course saphenous nerve will be medial. And then now you see this nerve is known as actually the anterior division of the obturator nerve. Now actually this obturator nerve will actually arise from what we call the ventral rami of actually L2 to L4. It will actually run actually in the abdominal area, and it will actually run medial to. So when we actually look at the posterior abdominal wall in detail, we look at the nerves over there, we will actually look at that one. It will actually run medial to what we call the psoas major muscle. Of course, in the pelvic region, it will run on the lateral aspect of the pelvic wall. okay, and then in the to actually enter the pelvic area, of course, and of course it will bifurcate, and then give us what we call the anterior division and of course the posterior division. Now the anterior division, which is this one, okay, will actually run. Actually, this is the muscle known as the adductor brevis muscle. Adductor brevis muscle. And this is actually, yes, we will have actually the cut section of adductor longus muscle. So running between them will be this anterior division of obturator nerve. So that's why we are saying that yes, the adductor longus will be supplied by the anterior division of the obturator nerve. Yes, even together with that of the adductor brevis muscle. Now, if you remember this, yes, we saw it over there. That's the adductor canal, where of course the neurovascular structures, okay, of the femoral triangle, okay, entering in the anterior thigh region, will get to the posterior aspect of the leg, and this adductor canal, yes, because of this muscle, there's this kind of muscle which yes is not shown over here, and that's the sartorius muscle, the longest muscle. We can also call the adductor canal the subsartorial canal. So as I said, yes, the actions performed by the adductor longus muscle. Yes, I've told you that these muscles are generally adductors. So this is the midline of the body, okay, so bringing the lower limb closer to the midline of the body is by the courtesy of adductor longus, okay, it's performed by that one. So that is what we call adduction. Then when you take it away from midline of the body, that is what we call abduction, adduction, to add something, so to speak. And then we said it's also going to help in flexion of the lower limb at the hip joint. So you can see, this is flexion, okay, this is flexion. So when you flex, the angle over here is reduced, and this is when you extend it, opposite movement of flexion. Okay, so that is what will be performed by what we call the adductor longus muscle. Now deep to the adductor, so when I cut the adductor longus muscle and I flex it deep to it, I'm going to have what we call adductor brevis muscle. The word brevis has to do with short, so we have the longer muscle, adductor longus, being more superficial, okay, to what we call this short muscle, which is known as the adductor brevis muscle. Adductor brevis muscle. Now this adductor brevis muscle, will actually originate, somewhere in the anterior aspect of the superior pubic ramus, as well as the pubis, the ramus of the ischium. So we can generally say that it's going to originate from actually the ischiopubic ramus, and then to also insert this time around on actually the shaft, yes, proximal shaft of the femur, okay, that's the proximal 1/3 of the medial lip of what we call the linea aspera. Remember that the adductor longus actually came to the middle 1/3 and then inserted on the medial lip of the linea aspera. So that is the adductor brevis muscle. Now this adductor brevis muscle, yes, will be important in laterally rotating the thigh. So it can help in what we call lateral rotation of the thigh, so that you turn the thigh away from the midline of the body. Okay, you rotate it around, away from the midline of the body. So that is the lateral rotator of the thigh. So that is the adductor brevis muscle. So just like adductor longus, yeah, this one will also be supplied by what we call the anterior division of the obturator nerve. But remember that deep to this one we have what we call a very large muscle known as the adductor magnus muscle. Now this adductor magnus muscle, yes, in between the brevis and the magnus, will also be the posterior division of the obturator nerve. Will be the posterior division of the obturator nerve. Now what happens is that therefore I can say that yes, the posterior aspect of this muscle also gets some innervation from what we call the posterior division of the obturator nerve. So as I was saying, yes, you can see this muscle, okay, so this is actually going to be so you can see the muscle which originated from here, the cut section over here. This is actually the adductor longus muscle, okay, and then deep to that you have what we call the Adductor Brevis muscle, and then deep, quite deeper to that, you have what we call the Adductor Magnus muscle. So running actually between these two, okay, as you can see it over here, running between them, we will have what we call the posterior division of the obturator nerve. Okay, so that is what we are going to see. So when we actually look at this adductor magnus, it's actually the largest muscle in the medial compartment of the thigh. Now this muscle is having two hairs. Okay, it's actually going to have two hairs. It's going to have this oblique head, okay, running obliquely, and then we also have this vertical head. So actually this the oblique head, okay, running obliquely, we can also call it the adductor head. Yeah, it's actually called adductor magnus, but this is actually the adductor aspect of the adductor magnus muscle. Okay, so it's actually going to originate from what we call the inferior surface of what we call the ramus of the ischium. Okay, ramus of the ischium, together with some portion from that of the ilium. Okay, some portion, so we can say from the inferior aspect of the ischiopubic ramus. Okay, we can actually say that. And this time around, yes, it will actually run. You can see how the fibers are run obliquely, somewhat inferolaterally, run inferolaterally to actually insert on what we call the gluteal tuberosity. Okay, in the posterior aspect of the femur, we have what we call gluteal tuberosity, as well as of course the linea aspera. So this is how the muscle will actually have its attachment. That's the oblique head, okay, or the adductor head of it. Now for the vertical head, the one which runs vertically, which of course, because of its relation with the hamstring group of muscles which are located in the posterior compartment of the thigh, which I'm going to get to, or can also be referred to as the hamstring head. So this one will actually originate from what we call the the ischial tuberosity. Okay, ischial tuberosity. Okay, we can't actually appreciate it so much here, but it actually originate from the ischial tuberosity. So if you want to actually appreciate these things that I'm actually doing, a lot of landmarks will be mentioned. So please visit the video that I've done on the osteology of the lower limb, and also try to look at the joint that I've done regarding the hip joint, regarding the knee joint, so that I get a complete picture. Try to understand these things. So as I said, the vertical head will actually originate from the ischial tuberosity. And to actually run all the way vertically to actually insert, onto what we call the medial, okay, supracondylar ridge somewhere here, as well as of course adductor tubercle. Now remember that the adductor tubercle is just superior to what we call the medial epicondyle of the femur. So that is what we are going to see. So because it's having two hairs or two parts, then its actions, or there will be two actions actually performed. So we have the part, the oblique head or the adductor head, will actually help in adduction. Okay, so that it can bring, look at where it is located, so that it can bring the lower limb essentially towards the midline of the body, closer to the midline of the body. So this adduction, add to it, adductor. And then it also help in what we call lateral rotation, at the hip joint, But because this vertical head, comes all the way to around where we have what we call the, knee joint, yes, it's going to actually help. It's actually going to help in what we call, extension, of the hip, extension of what we call the lower limb at actually the hip joint, and of course even at the knee joint. So that is what we are going to find regarding the adductor magnus muscle. But you realize that there is a small opening over here, okay, which is very important, so for that it will serve as the exit point for what we call the structures which were in the femoral triangle, in the adductor canal, femoral artery, femoral vein, the saphenous, nerve to vastus medialis. All those ones will be going through this area, exiting to the posterior part of the thigh, of the leg. Yeah, so that is that for you regarding the adductor magnus muscle. Now, the other muscle that we are going to look at is the obturator internus muscle. Obturator internus muscle. Obturator externus muscle. Now, remember that for obturator internus, yes, we saw it when we were looking at the gluteal muscles. Now, remember that the obturator internus, yes, was needed for actually to help in what we call, lateral rotation, of the thigh, okay, of the lower limb at the hip joint. But this time around, this obturator externus will be antagonistic to that of obturator internus muscle. So as you can see where it is originating from, it's actually going to originate from the external surface of the obturator membrane, together with, of course, the ischial pubic rami, around this area, okay, the bony structures around this area, and then somewhat run a bit superiorly, inferiorly, run inferior to what we call, actually deep to what we call the neck of the femur, to insert on what we call the trochanteric fossa. So look at where trochanteric fossa is, okay. So it's going to help in what we call actually lateral rotation, lateral rotation at the hip joint, it's because the trochanteric fossa is more or less going to be a bit laterally placed, okay. So this one will actually be antagonistic to that of that by what we call the obturator internus muscle. So that is what we are going to actually appreciate over here. So if you look at even the obturator internus that we looked at, yes, it was actually very important for actually abduction. It was quite important for abduction, but this one is actually going to be important in lateral rotation, or in what we call external rotation, moving it this way away from the midline of the body, okay. So that is what we have. Then of course we know this one will also be supplied by obturator nerve, actually going to be by the posterior division of the obturator nerve, So that is that for you. Now, the next muscle which we are going to look at is known as the Gracilis muscle. And this, Gracilis muscle, yes, will be, look at this slender muscle over here. Now, this Gracilis muscle, yes, we often refer to it as the virgin muscle, or the custodian of virgin, or the anti-rib, muscle. And I'll explain why we call it as such. This Gracilis muscle, yes, will actually originate somewhere on the inferior aspect of what we call the superior ramus of the ischium, okay, a bit superior aspect, okay, and then it comes all the way to insert actually on the medial aspect of the shaft of proximal shaft, just immediately below what we call the tibial condyle of the of the tibia, medial shaft, superior proximal portion of the shaft of the the tibia, okay. So as you see, it runs inferiorly and somewhat laterally, actually inferiorlaterally, in that manner. Now, but one thing that we are saying is that yes, we have to know that this one will insert actually behind the insertion point of the sartorius muscle, insertion point of the sartorius muscle. And again, this muscle will actually, yes, be innervated by the anterior division of the obturator nerve. Now remember that this muscle is the most medial muscle in the medial compartment of the thigh. These things are very important. You have to anticipate where these muscles are. You have to know whether it's more lateral, more medial. You have to do that so that in transverse sections you can easily identify these muscles. So I mean this muscle. Now, why are we actually saying that is a custodian of virginity? Because this muscle is very important in adducting the lower limb. Okay, it is very great adductor of the thigh. Great adductor of the thigh. Apart from that, it's also going to help in what we call medial rotation of the thigh, so that what will happen is that essentially you can put your lower limbs together so that you don't allow someone to rape you. That's why we call it an anti-rape muscle, or the virgin muscle. So that is why we call the sartorius muscle, which is going to be antagonistic to this gracilis muscle, the honeymoon muscle, so that when you are ready, then that is when you can actually use what we call the sartorius muscle to actually cause lateral rotation and of course abduction. So just get to know that yes, the gracilis muscle, we are referring to it as the virgin muscle, or the custodian of virginity, because of course if there is medial rotation, or if you actually adduct your thighs, then what will happen is that the male cannot penetrate for coitus to be possible. Okay, so that is one thing that we have to know. And remember, its antagonist, which we saw it in the anterior compartment of the thigh, being the honeymoon muscle, is actually the sartorius muscle. Now, even apart from helping in medial rotation as well as adduction, okay, what will happen is that the gracilis muscle will also be important in knee flexion at the knee joint. Okay, so there's a flexed knee, and opposing to that will be the extended knee. So these are actually the things that we have to know. Just before I talk about the groin strain, one other thing too that I have to tell you, regarding the adductor magnus muscle. Yes, this adductor magnus muscle, yes, we saw that there was a vertical one, vertical head, or the hamstring part. We also saw that there was an oblique part, or the adductor part. Now remember that the adductor part, yes, will actually be supplied by what we call the posterior division of the obturator nerve, because we saw that between the adductor brevis and the adductor magnus was the posterior division of the obturator nerve. But if you look at the hamstring part, or the vertical part, it will actually be supplied so it means that it's also a hybrid muscle. It will actually be supplied by what we call branch of the sciatic nerve, which is actually the tibial nerve, actually coming from L4 to S3. So that's one thing that we have to actually appreciate. Now, if you look at this slide, now we are looking at what we call groin strain. Now, it's going to be actually an injury which one will sustain as a result of tear to the adductors of the thigh. Okay, so the medial compartment muscles, if they get torn, then what will happen is that it will lead to what we call that kind of strain, groin strain. So generally this one will happen when there's sudden movement by an individual. If there's sudden movement, okay, which will cause that kind of acute strain in the groin area. Okay, that is what we are going to see, especially when you are kicking ball, when you suddenly twist suddenly, generally from actually extreme stretching generally will actually cause tear to any of these muscles in the medial compartment of the thigh. So, but generally what will happen is that they will tend to affect what we call the proximal parts of the muscles. Okay, of the muscles to be affected. Now, if you have such condition, then what will happen is that you have to apply the rice remedy. Okay, because there's that kind of strain over there, or sprain. Even if it's sprain or strain, then what will happen is that you have to apply the rice method. And R is for rest. You have to rest that limb. You have to apply ice, I for ice application, C for some compressions to be done, and then E for elevation. But you can see in this slide that for the grade 1, yes, it's quite mild. with less discomfort, doesn't bring any disability actually. Yes, so the person can actually move. With grade 2 groin strain, then the severity keeps on increasing. There's limited ability to perform some activities with moderate swelling and bruising as well. Then for grade 3, of course, this one is quite painful, so it's at the extreme end, which will lead to actually muscle spasm and swelling. And of course, there will be significant bruising around the area. So one actually experiences severe pain while actually walking. So these are that muscles of the anterior compartment of the thigh, sorry, medial compartment of the thigh, that we've seen. We've seen the adductor longus, adductor brevis, adductor magnus. We've also seen obturator, externus muscle, as well as of course the gracilis muscle. So we want to actually go to the posterior compartment of the thigh, the muscles over there. Now remember that in the posterior compartment of the thigh, these muscles are referred to as the hamstring, muscles, hamstring muscles. We can also refer to them as such. Now these hamstring muscles, yes, one thing that you have to know is that they actually generally will cause what we call extension. Okay, this time around, extension at the hip joint, extension at the hip joint. But what will happen is that they will cause what we call flexion at the knee joint. So while causing extension at the hip joint, they will cause what we call flexion at the knee joint. And then of course, in the posterior compartment of the thigh, the hamstring group will be supplied by nerves to the posterior compartment of the thigh, being the sciatic nerve or branches of the sciatic nerve. So that is what we are going to see. Now over here, yes, one thing that you have to appreciate is that there are just 3 muscles that we are going to deal with. We are going to deal with what we call the Bicep Femoris. We look at Semitendinosus Muscle. We also look at the Semi-Membranosus muscle. So in this one, we have this muscle being one of the muscles of the posterior compartment of the thigh, being Biceps Femoris muscle. Biceps Femoris. So the word biceps means that it's going to have 2 heads and therefore 2 origins actually. It's going to have a long head and a short head. Now the long head is originating, yes, from the ischial tuberosity, a bit superior, superolateral aspect of the ischial tuberosity. Okay, and then runs, somewhat, inferolaterally, crossing distally where we have the condyle of the tibia, the lateral condyle of the tibia, to insert actually on the head of what we call superior aspect of the head of the fibula, Okay, so that is what we find with what we call the long head of what we call the Biceps femoris. But what happens is that before it inserts onto the superior aspect of head of fibula, the lateral emerges with the lateral head, the short head of the Bicep femoris. Now the short head, will actually originate from, as you can see, there will be the lateral lip, but this is actually coming somewhere from the medial lip, okay, of what we call the linea aspera, okay, as well as some portion of the supra condylar ridge of the femur, actually medial supracondylar ridge, okay, of the femur. Somewhat it's going to come from actually the lateral aspect, okay, this way, and then forms a common tendon with what we call the long head to insert on the superior aspect of the head of the fibula, So that's the biceps femoris muscle. Now this biceps femoris muscle, now one thing I have to know is that in the posterior compartment of the thigh is the most lateral muscle. So you should keep these things in mind so that in transverse sections you can actually appreciate which muscles are supposed to be at a particular place. Now it's going to help in, of course, knee flexion. Then it's also going to help in extension of the thigh, as these muscles are going to do, okay, and they also help in somewhat lateral rotation, of the lower limb, but actually going to happen at both, yes, the hip joint as well as the knee joint. So the bicep femoris, yes, the long head, yes, will actually be supplied by what you call the sciatic nerve. Okay, so its innervation will be coming from the sciatic nerve, and then the short head will actually coming from what you call the common peroneal, nerve. Now remember, I will actually go through, generally, the course of the sciatic nerve for you. But what happens is that the main trunk of the sciatic nerve will actually supply the long head. But at a point, the sciatic nerve will actually divide into the tibial branch and then the common peroneal branch. Because this one is at a lower level, it's actually the common peroneal branch which will actually supply it. Now, the next muscle is known as Semitendinosus muscle. Now, this the biceps femoris muscle. Now, the semitendinosus muscle is actually finding itself between this biceps femoris, laterally, and what we call the semi-membranosus muscle, which I'm coming to. But what happens is that for you to actually identify them, you get to know that the semitendinosus will have a long tendon which will lie on the belly of what we call semi-membranosus muscle. So it tells us that if you take a transverse section somewhere here, then what will happen is that superficial will be the semitendinosus and deep will be the semi-membranosus muscle. So actually the tendinosus muscle will originate from actually the ischial tuberosity. We saw that the long head of biceps femoris also originated by actually from the superior lateral aspect, but this one from actually a bit inferior medial aspect to where the biceps, long head of biceps femoris actually originated. And then runs almost vertically. Yes, you can see vertically to actually insert on what we call the medial aspect of the proximal shaft of the tibia, just below where we have the tibial, where we have the medial condyle of the tibia, So that is what we are going to see. But of course, some portion may also go and all the way to insert onto what we call the tibial tuberosity. Okay, medial aspect. Some portion may actually be there, but mainly it will just be actually medial to where we have what we call the medial tibial tuberosity. So that's what we call tendinosus muscle. This semitendinosus muscle will be very important, yes, in actually flexing, okay, helping in flexion at the knee joint, yes, of course, extension at the hip joint, and it also help in what we call medial rotation, okay, medial rotation of the thigh. Remember that the bicep femoris, because it was laterally located, it was helping in what we call lateral rotation. But because semitendinosus is a bit medial, it's going to help in medial rotation. Now, one other thing too is that yes, this medial rotation, yes, is going to happen at the hip joint, okay, and it's also going to help in medial rotation of the leg actually at the knee joint. So that's one thing that we have to appreciate. Now, of course, it will be innervated by actually what we call the tibial branch of what we call the sciatic nerve. Now, the next muscle, which will be deep to the tendinosus muscle, will be what we call semi-membranosus muscle. So as you can see, it's also originating from where we have what we call the ischial tuberosity, actually the superior, lateral portion of the ischial tuberosity, okay, and then runs, somewhat, almost vertically to actually insert on the posterior, aspect of the medial condyle of, the tibia, okay, of the tibia. So that is what we find over here. That is what we call membranosus muscle. So remember that biceps femoris is lateral, semitendinosus is medial, but it will lie superficial to the semi-membranosus muscle. So such that the tendon, the long tendon of semitendinosus, will lie on the belly of semi-membranosus muscle. So this semi-membranosus muscle, yes, will actually, help in flexion of the lower limb at the knee joint, help in extension, actually at the hip, extension of the thigh, at the hip joint, and it will also help in what we call medial rotation of the thigh at both the hip joint as well as, of course, the knee joint. So that is one thing that you have to know. Unlike the bicep femoris, which is laterally placed, semi-membranosus and semitendinosus are both helping in medial rotation of the lower limb. Yes, of course, just like semitendinosus, it will also be supplied by what we call the tibial branch of the sciatic nerve. So these are the muscles which are going to form the posterior compartment of the thigh. Now, if we look at this, I've been talking about all these things. I've been talking about the sciatic nerve and all that. Now, this sciatic nerve, as you can see it over here, okay, who actually, yes, go through the greater sciatic, foramen, okay, to come to the posterior aspect, okay, of the gluteal region. And of course, you can see that it's running between where we have, medially, where we have what we call the ischial tuberosity, and of course laterally where we have the greater trochanter running between them, okay, actually to actually get to the posterior compartment of the thigh, okay. So that in the posterior compartment of the thigh, just before you get to the popliteal fossa, it will actually bifurcate to give us a medial branch, okay, so to give us a medial branch, which is known as the common peroneal nerve, the tibial nerve, and then a lateral branch being the common peroneal nerve. Okay, so that is what we are going to find over here. So these are the nerves that I've been talking about. But sometimes it can even bifurcate somewhere even at an upper level. So there could be that kind of variation at the point where the sciatic nerve is going to bifurcate. So that is one thing that we saw when we looked at the sciatic nerve, that is and deep to the sciatic nerve, as it enters the posterior compartment of the thigh. Now, one key thing that I want to say here, yes, regarding these hamstring muscles, is that there could be a problem where we have something like hamstring strain or even avulsion of the tibial tuberosity. So I actually want to go to, so for instance, looking at the activities that the people are going through, the activities that you find over there, yes, something like sporting actively, hurdling, or even sprinting, you can see, or even in football, okay, you may have a condition where some parts of what we call the ischial tuberosity. Now you can see that the ischial tuberosity is becoming a very important origin for these hamstring muscles. They are having that common origin from the ischial tuberosity. Okay, so what happens is that if there's too much strain on them having any of these activities, doing them regularly, okay, then what will happen is that some portions of what we call the ischial tuberosity could actually rupture. Okay, could be broken off, okay, as a result of the tearing of any of these hamstring muscle tendons, okay, and that one is what we're going to lead to what we call avulsion of the tibial tuberosity, okay. So that is one thing that you have to know. Again, with this same sporting activities, what happens is that there could be excessive strain on these hamstring muscles, okay, and what will happen is that yes, it could lead to excessive stretch or tearing of any of these muscle fibers, okay, and what happens is that yes, it may cause something like rupturing of the underlying vessels, and may lead to actually what we call hematoma which will actually get collected, okay, within what we call the fascia lata that overlies it. Now again, this one too is when we have what we call hamstring strain, then you have to apply, yes, a non-pharmacological approach, which is, we use the mnemonic RICE, and that is resting. Yes, you have to rest that limb. Yes, you have to actually apply ice. Yes, you have to do some compressions, and of course help do some intermittent elevations. So these are the things that we have to appreciate regarding these hamstring muscles. So we've seen actually, yes, the muscles that form the medial compartment of the thigh being mainly adductors. We've also seen muscles that form the posterior compartment of the thigh, mainly going to help in what we call flexion at the knee joint, and then of course extension at the hip joint. So I hope you find it helpful. I hope to actually go through that of the the leg and that of the foot in no time. Thank you very much, and may God richly bless you.